Hi everyone, and welcome back to another video. Today we're going to be going over minoxidil's mechanisms of action for hair growth. In other words, how does minoxidil actually work as a treatment for hair loss? And we're basing today's video off of a bunch of different studies, but these are the main two. And so let's get right into it. So it's worth mentioning that minoxidil gets converted into its active form, minoxidil sulfate, via sulfation by the sulfotransferase enzyme. The main difference between minoxidil and its active form, minoxidil sulfate, from a molecular standpoint being the SO4 group here on the top of the molecule. And if we look at this snippet from a study, it says scalp sulfotransferase activity was higher in men who responded to minoxidil compared to those who did not respond. In other words, minoxidil has to be converted into its active form, minoxidil sulfate, in order for it to actually exert its hair promoting effects. So let's actually talk about the mechanisms of action for minoxidil now. We'll start by discussing vasodilation, as this is the most well-known mechanism of action for minoxidil. And minoxidil actually causes vasodilation through ATP-sensitive potassium ion channels. So that's this protein over here. This is a channel that opens up when exposed to minoxidil, and it allows potassium to go in and out of the cell. Now, when potassium goes into the cell membrane becomes hyperpolarized. This means that it has a net negative charge. And if we consider a bunch of cells in the cell membrane for a second, if they become hyperpolarized, if they all have a net negative charge, what happens is the same charge repels, right? So the cells will become more distant from one another, which is what leads to vasodilation. It's also worth mentioning that there's another type of channel called voltage-gated calcium ion channels, which actually close when the cell becomes hyperpolarized. So there's a reduced influx of calcium ions into the cell, which once again just leads to vasodilation. Okay, so minoxidil causes vasodilation, but why does this matter? The increased blood flow per unit of time will increase oxygenation and nutrient delivery to key cells in and around the hair follicle. But if we look at these studies, we can see that in patients with early male pattern baldness, subcutaneous blood flow was 2.6 times lower than the values found in normal individuals. And this was statistically significant, and the conclusion is that a reduced blood flow to the hair follicle might be a significant event in the pathogenesis of early male pattern baldness. And this other study reaches a similar conclusion, and it says that there is a microvascular insufficiency to regions of the scalp that lose hair in male pattern baldness. And we have identified that tissue hypoxia in bald scalp compared to hair-bearing scalp. So in other words, blood flow to the hair follicle is pretty important. So minoxidil, by causing vasodilation, is able to improve hair loss parameters, or is able to improve hair growth, or at least slow down hair loss in certain patients. Okay, now let's discuss VEGF, which is Vascular Endothelial Growth Factor. This is a protein that minoxidil can upregulate. So minoxidil stimulates VEGF synthesis by dermopapilla cells. Okay, great. So when exposed to minoxidil, we have more VEGF. But what does this mean? So VEGF leads to angiogenesis, which is the formation of new blood vessels. So consider this for a minute. Suppose you have this follicular unit with a very weak microvascular supply. Through angiogenesis, or the formation of new blood vessels that can be achieved by VEGF, we can actually increase or improve the microvascular supply around the hair follicle, which can once again improve blood flow to the hair follicle, improving oxygenation and nutrient delivery to key cells in the dermal papilla. So moving on to delayed senescence. Now, I've added a question mark because the study supporting this is a cell culture study, basically a Petri dish study, but it's worth mentioning nonetheless. So we have normal cells that can become senescent cells. Senescent cells are basically just old zombie cells that don't function as they used to. And senescent cells can trigger inflammation, right? So here we have this inflammatory byproducts from the cell. And here we have some more snippets from a study that says minoxidil inhibited growth of human skin fibroblasts, and minoxidil can delay cell senescence. Okay, so what does this actually mean? So let's consider a skin fibroblast. This is a cell. A fibroblast can differentiate into fibrosis, right, which is basically scar tissue. And this matters because if we graph this baldness chart, as baldness increases, what we typically see is an increase in fibrotic tissue, right? Fibrosis. This is scar tissue in the scalp. Now, as fibrosis increases, what we typically see is a decrease in inflammation. So fibrosis goes up and it clears up inflammation, but the side effect is baldness. So if we're able, through minoxidil, to delay senescence, we are therefore delaying or reducing inflammation, because we know that senescent cells cause inflammation. And by reducing or delaying inflammation, we can delay or reduce fibrosis, and therefore delay or reduce baldness. And now moving on to hair cycle maintenance. So in this study, it says that pattern baldness, there is a gradual reduction in the duration of the anagen. This is the growth phase of the hair cycle, and a prolongation of the latent period of the hair cycle, which is the telogen. And it also says the minoxidil affects hair cycling, causing premature termination of telogen and probably prolonging of anagen. So how does minoxidil actually prolong the anagen or the growth phase of the hair cycle and reduce the telogen phase? So it does this by prostaglandin modulation. So let me explain what that means. So prostaglandins are substances in our body that are produced from the fatty acids that we ingest. And minoxidil can upregulate prostaglandin endoperoxide synthase 1, which is a bit of a mouthful, but this is an enzyme that leads to the creation of prostaglandin E2. Now, some prostaglandins, like PGD2, are actually bad for hair growth, or actually contribute to hair loss. But some prostaglandins, like PGE2, which is this one over here, are actually good for hair growth. Good for hair. And so, yeah, minoxidil upregulates the enzyme that produces prostaglandin E2. Prostaglandin E2 goes up, and this helps maintain healthy hair cycling that can contribute to normal hair growth. Now, it's also worth mentioning that minoxidil is not fully understood. There's still a lot we don't know about minoxidil, and I'm sure that we'll learn a lot more over the coming years. And lastly, if you are experiencing hair loss or you know someone who's experiencing hair loss, I've written this free ebook. It's free. You can download it in the link in the description below. You'd be silly not to download it. So step 1, I recommend you download the book if you want to. And step 2, if you enjoyed this video, then be sure to subscribe. And with that in mind, I hope you have a great day, and I'll see you in the next one.